If you are taking thyroid meds and your labs are normal, but you still feel exhausted, foggy, inflamed, have weight gain or weight struggles, or anxious, this video is for you. Hi, I'm Athena Newell. I'm a family nurse practitioner specializing in functional medicine at Stat Wellness in Charleston. We're going to break down what your thyroid actually does, the differences between levothyroxine, liothyronine, desiccated thyroid medications like Armour or NP Thyroid, Tirosint, and compounded thyroid medications. We'll talk about when and when not to add medications like T3 or liothyronine, why we should always test for autoimmune thyroid like Hashimoto's and Graves', how lifestyle plays into optimizing thyroid function, and what to do if you're taking thyroid medications and you're still not feeling very well. So let's get into it. What is the thyroid? The thyroid is a butterfly-shaped gland that sits in your neck, and it regulates so many systems in your body, but specifically your metabolism. Your thyroid produces hormones like T4 and small amounts of T3. T4 is your storage hormone. T3 is your active hormone, and your body converts T4 to T3. And your body must convert T4 to T3 to actually produce energy, support your metabolism, regulate your body temperature, support mood and cognition, and maintain things like your hair, skin, and menstrual health. We convert T4 to T3 in the gut, liver, and other tissues in the body. And the brain communicates with the thyroid using a hormone called thyroid stimulating hormone, or TSH. So now let's talk about all the different types of thyroid medication and what the differences are between them. The most common medication prescribed for thyroid conditions is levothyroxine. Some other names for that medication is Synthroid, Unithroid, but the generic medication is called levothyroxine. This is the standard of care. It's a synthetic T4 only medication. And when we give this, we are assuming that our body is going to take that T4 levothyroxine hormone and convert it to T3 effectively. This works well for many patients, especially those who have an intact conversion process. Great for stable, uncomplicated hypothyroid patients. But about 10 to 15% of patients continue to have symptoms despite taking an adequate amount of medication or having a normal TSH. And this is where the nuance begins. So another option for hormone replacement is a medication called liothyronine, or T3. This is active T3. It works fast and has a very short half-life, so it doesn't hang around in the system for very long. We'll consider adding this medication when a patient is having persistent symptoms and maybe they have a slightly elevated TSH. They're showing evidence of poor conversion, which would look like having a normal T4 hormone level on their labs, but having low T3 hormones. This is not for a patient who has persistent or unaddressed adrenal dysfunction, uncontrolled anxiety, any sort of cardiac arrhythmias, and if their TSH is already suppressed or low. T3 is a powerful tool. It can be life-changing or it can be overstimulating if used incorrectly. So now let's talk about natural desiccated thyroid hormones. Examples of this medication are Armour Thyroid or NP Thyroid. These contain a combination of T3 and T4 hormones at fixed ratios, and they're derived from porcine or pig thyroid. The pros of using this medication: some patients feel dramatically better on this combination, and it includes a natural form of T3 and T4. The cons: it's a fixed T4 to T3 ratio, so it's not very customizable. There's higher T3 amounts in this medication, which is not the same as the human ratio that we usually make. And we do see a bit more fluctuations in especially sensitive patients because these medications are not perfect because they come from animal products. This combination isn't better or worse, it's just different, and some patients truly do better on these medications, but it's not for everybody. Okay, now let's talk about compounded thyroid medications. This is a great option when you really want to customize somebody's dosing, specifically when you're looking at getting the right T4 to T3 ratios. This is great for patients who are especially sensitive to fillers of other medications, when you want to microdose T3, when you're trying to split doses throughout the day to optimize for energy levels, so maybe taking some a little bit in the morning and a little bit in the afternoon because it has a short half-life, so it doesn't stick around very long. You can also customize slow release T3 so you get a more steady dose throughout the day. So to pull it all together, compounding meds offer customizable ratios, slow release T3, and filler-free formulas. Now let's talk about Tirosint, which is our gluten-free version of levothyroxine T4 hormone. It's actually one of my favorite versions because I really find that patients patients who are struggling on other forms do really well on Tirosint in the right circumstances. It's formulated for patients that have the autoimmune disease celiac and can absolutely not take gluten. But I also find that some of our autoimmune patients that are pretty sensitive to gluten do better on this version as well. We also find that some patients absorb this form of medication better, which ultimately results in lower dosing of hormones. Okay, now let's talk about autoimmune disease. If you have hypothyroidism and no one has checked for thyroid antibodies, your diagnosis is incomplete, in my opinion. Hashimoto's is the most common autoimmune disease with our hypothyroid patients. All of my hypothyroid patients get checked for this because it really does guide treatment for our patients. So what are we looking for? We test for TPO antibodies and thyroglobulin antibodies. These antibodies, when elevated, are attacking our thyroid gland and can cause damage. And in the long run, our main goal for thyroid function is to preserve tissue. Our thyroid isn't like the liver, where if we see a little bit of damage, it regenerates and we're back in business. The thyroid is not like that. It is not known to regenerate. So once we have cell death, it's not going to start producing hormones. Our job is to preserve tissue in the thyroid as long as possible. This minimizes doses getting increased over and over for the rest of your life. So with autoimmune thyroid, we can see inflammation happening to the thyroid gland. That can cause fluctuations in medication needs. We see increases in reverse T3, which is our inactive T3. We also see it impacting mood and fatigue, which is independent of their thyroid hormones. You can have normal thyroid hormones, but if your immune system is still attacking your thyroid gland, you still might not feel well. And this is also where we want to look at our patients from a holistic perspective, because things like gut health, inflammation, stress, sleep, nutrient depletion and nutrition and exercise all can play a role in how our thyroid is functioning and how our immune system is responding. Thyroid medication isn't the whole story. It's just one piece of a bigger physiological ecosystem. So if you're on thyroid meds and you still don't feel like yourself, it doesn't automatically mean that you need to make a medication adjustment. But it probably does mean that you need to do a deeper evaluation, because your thyroid does not work in isolation, and neither should your care. If this video was helpful for you, subscribe to our channel. And if you're local to a stat location, we offer free 15-minute consults to talk through whether functional medicine will support you and your thyroid issues. Thanks for coming.